Hello, today I'll be demonstrating the technique on how to perform a dry clean dressing change and how to perform a safe hand washing. First, we're going to check our orders. We verify and make sure that the orders are accurate and we've compared them to par. Next, we identify our patient. We get them to identify, state their name, their date of birth, and we check their armband. Next, uh, we've done the right checks, the right person, the right procedure, the right place, the right time, in the correct order. Next, uh, we gather our supplies. We make sure that our supplies are in the right date and that they're not expired. We've already gathered consent from our patient to make sure that they're okay with having the procedure done, dressing change done. We go ahead and administer pain medication at this time to prevent any kind of discomfort during the dressing change. Next, we go in, we provide privacy for our patient. We wash our hands. Normally, before a dressing change, it takes anywhere between 2 to 5 minutes, making sure that we keep our hands uh, lower than our elbows. We wash up, make 1 inch above our wrist. We make sure that we uh, use warm water and not hot water. The hot water allows our hands, our skin to crack and provides discomfort for us as a healthcare worker. So we use the warm water. Make sure that we use antibacterial soap. Make sure that we are rubbing our hands and between each, we clean each finger separately. We also want to make sure we scrub underneath the nails, our palms, our wrists, and all areas for up to 2 to 5 minutes until their hands have been removed clear of bacteria. Next, we take and rinse our hands with the warm water, making sure that our hands are still remain below our elbows. We take a clean, dry paper towel and we pat our hands dry, making sure not to scrub. We pat our hands dry. After drying our hands, we take another dry paper towel and we turn the water off. We use a different towel to keep from transferring germs from the wet towel from the faucet and damaging the hand washing that we had done before. So after cleaning our hands and taking another dry towel and turning the faucet off, now we're ready to start our wound care procedure. So we have our sterile supplies. We've already checked our order, made sure that our supplies are in date. Patient has already gave consent. We've given our pain medication and allowed time for the medication to start working. So now we open up our package, always open away from us. Next, we will grab our gloves. Next, we will grab with our non-dominant hand underneath the cuff of our dominant glove to apply the glove safely to our dominant hand. Next, we will reach underneath with the gloved hand underneath the cuff and apply our glove to our non-dominant hand. Now that our gloves are on safely, now we can remove our supplies, make sure that they stay up on our sterile field. We have our gauze, and our ABD pad. We have our wipes, which we open. Okay, so now we take our sponge, take our gauze, and we clean down one side. And we take that to our dispose of it. Now we take the next gauze and clean down the opposite side and dispose of it. Now we clean down the middle and dispose of it. Now we take our other gauze in the same direction we take and clean. We dry it down one side, dispose of it. Down the other side, dispose of it. And next,